And taking a look outside this morning, this City Hall all lit up in pink for Breast Cancer Awareness Month and today for World Menopause Day. World Menopause Day is held every year on the 18th of October.
And the purpose of today is to raise awareness of options available for improving health and well-being. Health reporter Haley Hernandez is joining us now to explain. Good morning.
Yeah, good morning, guys, because the one thing that every expert will agree on about menopause is that there's a lot they don't know about menopause. But recently, there's been a rise in providers demanding answers and getting results. Some common symptoms of menopause include fatigue, incontinence, insomnia, and hot flashes. But that's just scratching the surface for some women who, contrary to prior beliefs, start experiencing symptoms as early as their 30s.
Skin and hair changes, you get hair thinning, you tip into prediabetes. I think a misperception, sometimes on clinicians' part, but definitely on women's part, is that you have to wait for full menopause to get care. And that is definitely not true. And I think a lot of women in their 40s suffer unnecessarily.
That's Kathleen Jordan, a menopause certified provider with MIDI, a virtual teledoc service specifically for menopausal women.
We make it really easy for women to access the care. It's an insurance covered platform. So use your insurance just like you do going to the doctor's office. You get in quickly. We can order tests you need, labs, x-rays, and Memorial Hermann then helps us deliver on those.
And for in-person experts, Texas Children's has this Menopause Center, which has everything from dietitians on staff to help you manage symptoms to researchers looking at how menopause impacts your long-term health. Inside here, everything is normal. Joint pain, weight gain, depression, it's not in your head. Around here, there are symptoms just as common as hot flashes, and treatment is available. Cardiologist Dr. Stephanie Coulter from the Texas Heart Institute stresses that seeking treatment is critical since your risk factors for dangerous health complications increases in menopause.
So if it's insulin resistant state, if it's hypertension, if it's hyperlipidemia, if you have diabetes, those risks and disease entities need to be aggressively modified and treated such that the blood pressure is 120/80. The LDL remains under at least 100, optimal for my world, 50 to 70.
And still ahead on the KPRC2 Plus live stream at 7 a.m., I'm going to be talking to a doctor from the Texas Children's Menopause Center to tell us more about common misconceptions in menopause. And we're going to debunk some of the thoughts surrounding treatment, such as hormone replacement therapies. You know, Dr. Jordan said that less than 4% of women are on hormone replacement therapies. And she said it's not for everyone, but it's probably for more than 4% of women. So we're going to talk about that a little bit.
Such a frustrating time, you know, going back and forth from different doctors trying to find answers.
It just feels like in today's age we should know more than we do. So yeah, Texas Children's Baylor's doing research on this, learning about long-term health, and
yeah, want to hear it
when it really starts to
Speed up that research.
Yeah,
Make up for some lost ground. Haley, thanks. Coming up.